So I've been involved with the leadership team for a while. I have never been as concerned about our capacity to care for patients as I am now. We obviously have been through the COVID pandemic and the previous waves. What's different about this wave is that the on-ramp is a lot steeper, but both the age at which patients were presenting, how sick they were when they were presented, and the number of interventions to resuscitate them and stop the dying process was much more intense than what we have seen in previous waves. What we're seeing now, though, is that our care teams are having to make tougher healthcare decisions, as well as healthcare is not happening in the ideal location. For example, this morning, we were holding 38 patients in our emergency room that normally would have a bed upstairs, but because there was no room upstairs, we had to continue their care in the emergency room. Some of them had been there for close to 2 days. I can tell you here at Lexington, our high water mark was 170 patients. We're at 144, which may not sound as scary. The difference is we have the most ICU and the most ventilated patients than we've ever had. Okay. Ventilated are where you need a breathing machine to live. The other thing that is scary is that they are younger patients. So we were having a discussion earlier this week. Younger patients, because they have more reserve, will live longer. That's good. Last time our COVID length of stay was 8 or 9 days. You either died or you were discharged. As younger patients come into the hospital infected, they won't stay 8 days. They'll stay 16, stay 21 days. And at the end, they'll either die or be discharged. One hospitalized patient for COVID may take a bed now for 2 or 3 weeks, whereas before they only took a week. That means it's a 2 to 4 week hospitalization as compared to a 1 week. That means we need 4 times as many beds to care for the same number of COVID patients. That is a different story than before.